Los Angeles County public health officials are getting ready to unveil next week a comprehensive plan for vaccinating the next phase of residents, including teachers, public safety officers, emergency services workers and other essential employees. Meanwhile, the county was ready to swing open the gates at another vaccination center on Friday, February 5, a second mega site in hard-hit Pomona. Across the board in recent weeks, the picture of the pandemic in LA County has been improving, with continuing drops in cases, hospitalizations and fatalities, though average daily deaths, a lagging statistic, are just now starting to drop. On Thursday, the county reported an additional 239 deaths and 5,028 cases. A total 17,539 people have died now in the county from the virus since the pandemic began, and more than 1.13 million people have tested positive. Daily cases reported Thursday did not include updated figures from Long Beach and Pasadena, which operate their own health departments. Pasadena reported separately 5 more fatalities related to COVID-19, raising the death toll to 269. 36 new cases increased the city's total to 10,376. As of late afternoon, Long Beach had not yet released an update. Countywide, there were currently 1,351 ongoing outbreak investigations, with 23% occurring at work sites. Officials called that evidence that infection prevention strategies were still very much needed. The number of positive new cases has averaged about 5,000 per day over the past week, a roughly 65% decline from peaks of roughly 14,000 per day on January 8. Hospitalizations as of Thursday continued their steady decline, falling to 4,796 with 1,333 in intensive care units. That number peaked at more than 8,000 in early January. But while daily admissions have declined from about 800 per day to roughly 400 this week, that is still nearly double the rate of admissions in July. While we're heading in the right direction, we still have a ways to go before our hospitals are not overcrowded and our healthcare workers are not stressed, Ferrer said Wednesday. Deaths, too, have begun to ease up, now at roughly 150 per day, having dropped roughly 30% since January. Deaths, however, are considered a lagging indicator because they often represent patients with lengthy stays in the hospital, and records are sometimes slow to matriculate into databases. On Wednesday, the county reported 256 deaths, for instance, coming close to a pandemic high and showing that the pandemic remains deadly for many individuals and families. Now more than 17,000 people have died. County officials, at the same time, were working up a plan for the next stage of vaccine distribution, which was to be unveiled next Tuesday at the Board of Supervisors meeting. The plan will likely aim to coordinate efforts across roughly 300 vaccination sites, combining many of the sites currently in operation under new umbrellas and initiatives, officials have said.